My name is Jennifer Reynolds. I am an EMT and I have been an EMT for 7 years now. I'm doing my topic on first aid training. This is our agenda, the introduction, understanding regulations, which I'm not going to go through it verbatim, we'll just go through the slides. Introduction to first aid training, understanding the importance and standards. The significance of first aid in the workplace. It's crucial for ensuring that your employees know what they're doing. If something was to happen to somebody, any kind of medical emergency, they have to have some kind of training to know what they're doing until EMTs get or paramedics get there. An overview of our 29 CFR 1910 requirements. Outline the occupational safety and health administration standards for workplace safety, mandating that employers provide adequate first aid training and resources to ensure a safe working environment for everybody. All right, key components and responsibilities. Some of the key components of CFR 1910. There's a wide range of safety standards, including related to first aid, emergency response, and medical services in the workplace, and employee safety. And some of the employer responsibilities, they are required to assess any workplace hazards, to provide the necessary training, and to ensure that the trained personnel are available to respond to emergencies, and to make sure that they are up to date every year on their certification. Employee rights and training requirements. Any employee has the right to receive the training that is relevant, effective, and accessible, ensuring they are prepared to handle emergencies and understand their roles in maintaining workplace safety. And here's some core competencies for workplace responders: CPR and AED usage. CPR and the AED. The AED is what shocks your heart to try to get it pumping. Any cardiac arrest emergencies need CPR and AED. Wound care and bandaging. Some wounds you bandage different than others. You have to know the effective wound care, when to clean, what to clean, how to dress it, monitoring the injuries and what to look for, how to prevent infection and make sure they're healing. Highlighting practical skills in first aid training. You've got to know how to dress wounds. You've got to know how to dress the wound. And then got your choking relief techniques, is what we call abdominal thrusts. It's in the 2025 update. They don't use the Heimlich maneuver anymore. It's called abdominal thrusts. It's essential for responding to airway obstructions. You've got to know how to do it. CPR compression rate has to be between 100 and 120 a minute. You can use Staying Alive or Baby Shark, and that's how you keep up with your compressions. It's crucial for maintaining your blood flow. During your cardiac arrest, it gets the circulation, it passes the blood through the body. And then you got your AED steps. To use your automated external defibrillator, you have to turn on the device first, and then you follow the prompts, which would be attaching the pads to the patient's chest, bare chest. Following the prompts, your AED will analyze the heart rhythm, and when it tells you not to touch, make sure everybody's clear of that patient, because if you're touching that patient when they get shocked, you're going to get shocked too, and it's going to throw your heart out of rhythm, and they're going to have another patient. Make sure you're not touching the patient. When they say clear, everybody do not touch the patient. And the importance of training for CPR and AED is the fact that It is vital for workplace responders. You have to be familiar with these techniques, and not only boost confidence, but it also ensures that people act swiftly and they know what they're doing, and to potentially save a life. I've done that once. Types of bandages. You have various types of bandages with first aid. You've got adhesive bandages, your elastic bandages, gauze is a big one. They each serve a specific purpose. It protects the wound from infection, plus in some cases it will help stop the bleeding. Some of your application techniques for your bandages, you have to know how to apply the different types of bandages, so it doesn't hurt the patient, so it doesn't restrict any blood flow that they need, and how to layer it in order to keep the wound covered. And your infection prevention, using sterile materials. Don't use something that's already out of the package. That's not good. Understand the importance of cleanliness in your patient's wound, and make sure you know how to recognize the signs of infection to make sure your patient is safer. Critical skills for severe bleeding control. Your tourniquets. Understand how your tourniquets work. You got the CAT tourniquet, which is also the combat application tourniquet. It's mostly for limbs. Make sure you put it 2 inches above the wound. Twist it down until you can't twist it no more. Lock it and make sure you write the time on it so first responders know how long that tourniquet has been on there to determine how fast they need to get going. Some of the proper techniques for application of the tourniquet is crucial. You have to secure it in place. Make sure it is secure after you put it on there. That's a good training technique to monitor for potential complications as you apply the tourniquet. Post-application care and monitoring of your tourniquet. It is essential to monitor the patient for signs of shock. If they've lost too much blood, they will go into shock, and ensure that the tourniquet remains effective and in place. Understanding in the field, you do not release the tourniquet. You let them do that in the hospital. But understanding when to release or adjust the tourniquet is vital, because prolonged application causes tissue damage. So you have to know that. Critical interventions for burn management. You have your 3 types of burns. You have your 1st degree, your 2nd degree, and your 3rd degree. They all have different treatment protocols, and recognizing the type of the burn and the severity of the burn is crucial for determining the appropriate first aid that you need to give to this person. Some of your immediate first aid measures. You cool the affected area with lukewarm water. Not cold water, not hot water, lukewarm water for 10 to 20 minutes to reduce your skin temperature and alleviate the pain. For chemical burns, you have to remove any contaminated clothing and flush the area with copious amounts of water to neutralize the chemical agent. Some long-term care and monitoring for some burn management. After your initial treatment, ongoing care is vital to prevent infection. You can easily get an infection with 2nd or degree burns. 1st degree burn is more like a sunburn. 2nd degree burn, you'll have some like boils, not boils, but they'll be popping up, and your 3rd degree burns is pretty much your skin is just missing. Monitor for signs of infection. Understand when to seek medical care. especially for severe burns, because they'll need to go to a specialized facility to take care of your 3rd-degree burns and possibly some of your 2nd-degree burns. All right, and here's some essential techniques for eye injuries. You need to understand your eye anatomy, and there's so many injury types. You need to understand them all and how to identify the nature of the injury. It can range from scratches to chemical burns to something stuck in the eye, like a pencil or a pen. You need to understand the protocols that go with each of these injuries because everyone gets treated differently. In the event of an eye injury, immediate action. Flush in the eye if it's a chemical burn, or copious amounts of water, or use saline. Avoid any movement of the eye whatsoever. That's whether if there's a pencil sticking out of somebody's eye, you can poke a hole in the bottom of the cup and put the cup over the pencil, over the eye, wrap both their eyes so they don't move their eyes around, and just keep it stable. Follow-up care is essential for preventing any blindness or any vision changes or increased pain. Any eye injury they need to go to the ER. And critical interventions for airway obstruction. Choking. Choking occurs when an object is obstructing the airway, preventing normal breathing. It can be caused by food, anything somebody puts in their mouth. You need to recognize the signs of choking, whether it's their inability to speak or they're turning blue, or the universal sign for choking is when people are holding their throat, and always ask are you choking? If they say, shake their head, yes, can I help you? You have to ask them if you can help them now. Some immediate response techniques is the abdominal thrusts. Adults, children over 1 year old, it's pretty much your abdominal thrust. For any infants that's under a year, we call it back blows and chest thrusts. Those are recommended. Call EMS, but you got to know when to call them during your compression or your abdominal thrust, your back blows. You have to know when to call EMS. It's different in adults and infants. Your post-intervention care, after you successfully dislodge the object, monitor the individual for any signs of respiratory distress or injury. If the person loses consciousness while you're doing an abdominal thrust, lay them down on the floor and do CPR. Make sure you call 911 ASAP. Rapid response to severe allergic reactions. You have to understand anaphylaxis, which is a fancy word for allergic reaction. It's severe, potentially life-threatening, depending on the symptoms somebody has when they come into contact with something they are allergic to. It occurs very rapidly after exposure to whatever it is they are allergic to. You need to recognize the symptoms of anaphylaxis and do a timely intervention. Immediate administration of epinephrine. You need to get training on how to use an EpiPen. It counteracts severe symptoms. Some people carry them with them, but you may have to administer it. It constricts the blood vessels, relaxing your airway muscles, and reduces swelling. But call 911 just in case. And your post-anaphylaxis care. After administering your epi, you have to monitor their vital signs. and seek emergency medical assistance as soon as possible. All right. And responding to your opioid overdoses, we usually use Narcan, naloxone, Narcan. You need to understand your opioid overdose and some signs and symptoms of that. Some people misuse their prescription pain relievers, or you've got the elderly who take their meds, forget they've taken their meds, and they take them again. That can be an issue. Anybody on drugs, heroin, synthetic opioids, fentanyl is a big issue now, a very big issue. Some of the signs is unresponsiveness, slower, shallow breathing, pinpoint pupils is a big one. Naloxone is an opioid antagonist. It rapidly reverses the effects of opioid overdose. It restores normal respiration and consciousness. But be careful, because if a person is on a drug overdose and you use naloxone, they usually wake up very angry because it takes their high away, and they will be combative. Not all of them, but some of them will be combative, so just be careful of that. Your naloxone can be administered intranasally in your nose or intramuscularly shot in your like you would an EpiPen. You need to train on the proper techniques, and the administration is essential. Then we have evaluating your competency and first aid skills. Evaluate your trainee performance, your in class, your both their knowledge and their practical skills, ensuring that they can effectively do their CPR, their naloxone, their first aid, their bandaging. Your certification process, it validates the competencies acquired during training, providing recognition for individuals who have demonstrated proficiency in first aid skills and knowledge. You got your recertification requirements. It depends, because there are different CPR classes you can take. Just ask the instructor how long the certification is good for and how you would go about recertifying. Emergency response planning. Preparing for workplace emergencies, you have to create a response plan. Make sure your work has a response plan, what your role is in it, where you need to be, what you need to be doing, and communicate and report. Make sure you write everything down. If you didn't put it in the report, it didn't happen. No matter who was there, it didn't happen. So make sure you report. All right. And summarizing the importance of first aid training. Some summary of the key points. We've covered the significance of first aid training, the regulatory requirements, the essential skills and effective training methods, all of which contribute to a safer workplace, and your importance of compliance with regulations. Adhering to OSHA and ANSI standards is not only a legal obligation, but also a moral responsibility to ensure the safety and well-being of all employees, even if you're not at work. Encouragement for ongoing training and preparedness. Continuous training and preparedness are essential for maintaining a safe work environment, encouraging a culture of safety and readiness among all employees. Thank you very much.